Assalamu alaikum, dear brothers and sisters. Alhamdulillah, we have a special guest today, Dr. Farah. She is an invasive cardiologist who were with us a couple years back at ITC. MashaAllah, may Allah subhanahu wa ta'ala bless her. All the activities and services she is providing in our community. So today's session is especially dedicated to the COVID vaccine and the impact on heart. So she has a lot of experience and she is serving in different organization as a board member and advisor. And I will go ahead and let her introduce herself. So welcome, Dr. Farah. Would you please introduce yourself?
Hi, Assalamu alaikum. I'm Dr. Farah. I am an invasive cardiologist, CEO and medical director of Bentley Heart. I, as you mentioned, also serve as an advisor to the government of India for their International Health Advisory Board. I'm also the founding director for Global Health Lines Foundation, and I'm also an assistant professor at the University of Oklahoma Health Sciences Center for Medicine. So thank you so much for having me today. It's a pleasure to be here. And if we're not providing that care within that time, your risk of death significantly increases. And even if the people who delay their care are to survive that heart attack, they can have serious implications from this down the road. So that leads us to complications related to heart attack. So there are many complications that can ensue at the end of heart attack. Number one, death, if care is not given in a timely manner. But aside from death, you can have heart failure. That's one of the key things that can come out of heart attack for those who survive their heart attack, and if for some reason care is delayed. Even if care is not delayed, in many situations, if the heart attack is big enough, if it's a massive heart attack, a lot of times people can have heart failure. Heart failure is a condition where the heart is a pump. Heart's job is to pump blood all day long. And so heart failure is a failure of that pump when it's not able to pump as much blood as efficiently. So in a normal heart will squeeze and relax, squeeze and relax. In a failed heart, it'll not squeeze as well. It'll just go like this. And so blood tends to stay within the heart and it's not perfusing, like it's not going to the rest of our body. That has serious implications in our life. First of all, it significantly decreases the lifespan. So on average, people with severe heart failure, they live about 5 years. Aside from that, the remainder of the life they do have, these patients, their quality of life really suffers. They're usually in and out of the hospital. They really can't do much. Life is different at that point. So the take-home point from this talk, this part of the talk, is know your symptoms: chest pain, shortness of breath, profuse sweating, indigestion-like symptoms, nausea, vomiting. If you're experiencing any of those, you need to see a doctor in a timely manner. There are other types of heart diseases. I touched base on 2, heart attack and heart failure so far. Next is arrhythmia. Arrhythmia is an issue when there is erratic heart rhythm, like the heart is not beating in a synchronized way anymore, like the way it does normally. That is a problem within the electrical circuit of the heart. Heart is a very unique organ. It's the only organ in our body that has what's called automaticity. In other words, heart has its own electricity. It can function on its own, unlike any other organ in our body. And so arrhythmia is when that electrical circuitry has an issue, and we tend to have symptoms from that, like palpitations. Heartbeat can become irregular. It can also beat really fast. It can also beat really slow, and that can cause people to pass out, faint, and things like that. So that's something, if you're experiencing any of those, again, you need to see your doctor, you need to see a cardiologist. Now I'm going to dive into the risk factors for heart disease a little bit. So risk factors, there are many risk factors. Some of the most common ones would be high blood pressure. High blood pressure is actually the number one reason for heart disease, and it's one of the key reasons why many people die. The next is high cholesterol. Um, High cholesterol, typically happens from, some of it is genetic, but a lot of it is lifestyle, what kind of food we're eating. And diabetes. Diabetes is a really big risk factor for heart disease. People with diabetes have 5 times higher risk of having heart disease as compared to those without diabetes. So diabetes is something that we really need to pay attention to. First of all, prevent it from happening. There are 2 types of diabetes, type 1 and type 2. Type 1, it's not really in your control. That's somewhat something you're born with usually. Type 2 is in your control. People usually get it. There's genetic as well, family history, but a lot of it is because of the kind of lifestyle. Again, it goes back to diet and exercise. Smoking. Smoking is a big risk factor for heart disease. It also accelerates the plaque formation in our coronary arteries. That's what blockage is. That's usually what leads to a heart attack. So all those things are very important. Family history is a key risk factor as well. Family history is not something that's in our control. That's hereditary. That comes from, usually first-degree relatives would be considered the biggest risk. Like, if your father, mother, or like first generation people who have heart disease, that would be a risk factor for you. So minimizing those risk factors would be really important. One of the risk factors that gets overlooked a lot is high blood pressure. It's overlooked by not just the people, but also sometimes by the doctors. A lot of times this is just not managed as aggressively. So I'm going to give a couple of numbers that I think is going to be really important for people to remember. High blood pressure. So what's considered pre-hypertension now is anything above systolic 120. So systolic is the main number we usually look for. So the top number, that's the top number when you're measuring your blood pressure. So the top number, if it's above 120, between 120 to 130, that is pre-hypertension. 130 and above is hypertension. So the key number really to remember is 130 over 80. So if you're going above 130 over 80, you really need to talk to your doctor and see if you need medicine to bring your blood pressure down. Blood pressure, again, is the leading cause of heart disease here in the United States. And also hypertension, which is high blood pressure, if not managed properly, can lead to heart failure over time. It can cause the heart muscle to increase in size, and it can cause different types of heart failures. Second thing I want to talk about is, we already talked about women's heart disease a little bit, but I briefly want to touch base on, there are certain specific types of heart conditions that exist only in women. Heart attack, heart failure, all those are pretty much similar in men and women, the mechanism, the way we get it. There's one particular one that's unique, and that's called peripartum cardiomyopathy. Peripartum cardiomyopathy. It's a very specific type of heart failure that happens to women during their pregnancy and peripartum time period. So women can get this anywhere between their third trimester, starting from their third trimester of pregnancy up until 6 months postpartum. What happens is the pregnancy puts a lot of stress in their heart, and their heart fails, the pump fails. And as a result, they go into heart failure. And some of the symptoms of heart failure are shortness of breath. That's one of the key symptoms, and swelling, lots of swelling in the legs. This is more prevalent outside the United States, like, in the South American, African, and sub-Saharan countries, like Bangladesh, like Pakistan and India. It's very prevalent there. A lot of women die every year from this condition. Even here in the United States, it has now become more prevalent here in the United States because Women are more career driven, so they're conceiving much later in life. Advanced age is a risk factor for this condition. And so we are seeing it more and more frequently here in the United States. So I just wanted to mention this for awareness purposes so that if anybody is experiencing these conditions during their pregnancy or postpartum period, to seek care and not just sit on it, because a lot of times these same symptoms can coincide with the symptoms of pregnancy, like swelling of the feet, and it gets ignored. And this is a very serious condition because if you don't treat this condition in a timely manner, then it could be fatal. It could be very fatal. So that's why it's very important to seek care in a timely manner. On the positive note, if treatment is provided in a timely manner, then the prognosis of this is very good. Usually, those women can come out of this type of heart failure and live a very healthy, long life. The other thing I want to mention, for people who experience peripartum cardiomyopathy, they do need to be very cautious and talk to their doctor regarding getting pregnant again in the future, because future pregnancies increase their chance of mortality significantly. So moving on now to the main reason why we're here, which is talking about COVID. I just wanted to give you a brief overview of heart disease, different types. So COVID is a pandemic, as all of us here know. It has taken the world by a big surprise. In the United States, we have been going through surge after surge after surge, and we just always beat the previous surge. So to go over our numbers, it's really bad right now. In the Tarrant County, in the entire DFW, all our hospitals are at maximum capacity right now. We have many hospitals in the Tarrant County that are so at max capacity. They have opened up different wards for COVID, and even those are at max capacity right now. I was just informed over this weekend that the hospitals are looking to, stop the elective procedures again. So it's coming soon, most likely, just like it happened during the shutdown period in March. They stopped all elective procedures for almost 2 months, where we couldn't do any procedures. So we were just given a warning over this weekend, that that's most likely going to happen again. We were already told not to do any procedures that require overnight stay because the hospital cannot accommodate. They are just simply out of beds. So that's where we are right now in terms of numbers. So COVID-19 is causing a lot of problems with the heart. The people who are experiencing heart conditions, heart problems, mostly that are becoming fatal, are the advanced age group, like 65 and above, and people who have risk factors. And those risk factors are the same as risk factors for heart disease that I mentioned earlier. Those include high blood pressure, diabetes, and people who have already known heart conditions like heart attack in the past. And also, of course, people who have heart failure. So what are some of the conditions related to COVID-19, heart conditions specifically? So one of the things COVID-19 is causing it's causing heart failure. It's attacking the muscle of the heart, and it's causing the heart to just give up the muscle. There's a condition called myocarditis. Myocarditis is inflammation of the heart muscle itself. And when that happens, it can cause several other things within the heart. So myocarditis is an inflammation of the heart muscle that is caused by the virus, because the virus is getting into the heart muscle and just causing a lot of inflammation. One of the things it can cause, of course, is heart failure, where the heart pump doesn't function as well. The other thing it can cause is arrhythmia. It can cause really dangerous type of arrhythmia, something called ventricular arrhythmia. There are two types of ventricular arrhythmias. One is ventricular tachycardia, and the other is ventricular fibrillation. They can both be fatal. And in the hospitals, we're seeing lots and lots of patients who are ending up in the ICU experience these two conditions. And a lot of people who end up dying from COVID, they usually die from multi-organ failure, because COVID-19, the virus, is causing a very overwhelming inflammatory response in the body. And as a result, it causes multi-organ failure. One of the first things that goes is your respiratory system, so your lungs. It's causing really bad pneumonia, and people just can't breathe anymore. They end up on the ventilator. But then one of the final thing that usually causes people to die is the heart, because eventually it's causing heart failure. They're having heart attack and arrhythmia, as I mentioned. So those are the key things we're seeing in the hospital setting in really, really critically ill patients. So initially, we really didn't have any guidelines in terms of what the proper treatment for COVID-19 should be. We really were just, using trial and error method. I'm talking strictly about inpatient hospitalized patients right now, and I'll go over the outpatient setting as well. And then, we had an enormous research and collaboration worldwide with universities, with different, private big institutions. And then we came up with remdesivir. Initially, there was a lot of talk of Plaquenil and things like that, but it, as you probably already heard, none of those have proven to be useful. Remdesivir was the only proven method treatment that was being used in the hospital. So remdesivir was actually being reserved for very ill patients. Not all hospitalized patients are getting remdesivir. It was not initially. It was primarily reserved for very sick patients, usually those who are requiring high levels of oxygen supplement. They're not able to hold their oxygen saturation on their own, or were concerned that we were concerned they would need ventilation. Those would be the ones who would require or get the remdesivir. Now we are giving remdesivir to hospitalized patients. Again, it's still not all hospitalized patients. It's those who have many risk factors and are likely to require a higher level of care. The second thing we're still using now in the inpatient hospitalized patients is plasma. We're using plasma. This plasma is basically, it's called convalescent plasma. It's something that's injected through IV, and it helps neutralize some of the virus load. The convalescent plasma is only being used for critically ill patients, even today, to this day. So those are all the inpatient settings, what treatments are available. Really those two, remdesivir and convalescent plasma. Everything else is supportive care when it comes to COVID. Everything else is supportive care. Meaning if the patient is having blood clots, which is one of the things COVID is doing, is it's causing what's called a hypercoagulable condition. It causes blood clots to form in different parts of the body. It can form in the leg veins. It can cause to happen anywhere, really. I've even seen some patients who had blood clot in their stomach arteries, and it caused, what's called ischemic bell. It's a very life-threatening condition. It can cause blood clots to go into the lungs. That condition is called pulmonary embolism, and that can be fatal as well. It can cause strokes. Many people are having strokes from the blood clots. So it's just throwing blood clots all over the body. So for those people, we're giving them blood thinners. That's called anticoagulation. For people who are, having breathing problems, we're giving them support with breathing. There are a lot of people who are having what's called COVID sepsis. Sepsis is basically, again, as a result of severe infection and inflammatory response, and they're going into what's called septic shock. Septic shock is when their body's basically just giving up. They're not able to hold their blood pressure. The blood pressure drops to dangerous levels. Their heart rate usually goes up. And of course, they can't breathe on their own. They require a higher level of care. They're usually the ones that are treated in the ICU. They require artificial medicines to keep their blood pressure up. And if they're having breathing issues, then of course they're on the ventilator. So those are some of the, supportive care that we're providing to the inpatient setting. There's another subset of group who, even despite all the support, we're giving them ventilator, we're giving them all the artificial medicines to keep them as well as we can, and even that is not enough. For those patients, we put them on something called ECMO. ECMO is a circulatory device. It's a very advanced therapy. Not every hospital even has the capability to provide this. There's only a handful of ECMO machines available in the entire DFW area among all the hospitals. Each hospital typically, like a major hospital, typically has one or two ECMO machines available. So just to give you a perspective of how difficult it is to get an ECMO in the setting of a pandemic when we have literally thousands of people in the ICU on the ventilator. So what ECMO does is it takes over the circulatory system. It circulates blood for the patient. So it's very, very advanced level of care. We have had many of our patients in the ICU in the hospital that needed to get on the ECMO. They did. Many of them did not survive. Some did. Some did come out of the ECMO and survived. So those are the inpatient settings. Now the outpatient. Majority of the people with COVID are in the outpatient setting. And this involves, all age groups, from infants all the way to the very elderly. And one thing we're all seeing is COVID is unlike any other virus we've seen so far. There's many different elements to it in terms of how it's affecting us. Initially we thought it was only affecting critically to the elderly folks who have lots of risk factors. We now know that is not true. We have people in their 20s completely healthy who needed to be on the ECMO. Many people who are young athletes. I've actually given a lot of news interviews on this topic. We lost a lot of athletes, like professional athletes, that succumbed to COVID-19. They died from heart-related complications that occurred as a result of COVID-19. So we cannot take, the point I'm trying to make is that we cannot take COVID-19 lightly, not for the elderly, not for the youngsters. Everybody needs to take the precautions. So going into precautions, I know the vaccine is out, but we still need to maintain the CDC guidelines. So the CDC guidelines at the moment are to continue to wear masks in all scenarios when you're outside of your home. So you have to wear your mask inside and outside, actually. I know many people who have contracted the virus because they didn't wear their mask outside and they're talking to people and that's how they got it. So you have to maintain wearing mask, maintain social distance. We have to maintain this until this virus gets in control. The other thing is traveling, not traveling unless you have to. Washing hands, maintaining immune health is very important during this time. So really taking care of your risk factors like high blood pressure, high cholesterol, taking your diabetes medicine, seeing your doctor in a timely manner, and paying attention to your diet. So you have to maintain a healthy diet, lots of vegetables, fruits, minimizing red meat. Those things are very important, eating fruits and vegetables to maintain a very good immune health. So eat a healthy, balanced diet. And then exercise. Exercise is very important. What we recommend is between 30 to 45 minutes of vigorous exercise a day, at least 3 to 5 times a week. So healthy diet and exercise, very important. I would say avoid going to the gym right now because gyms are a hotspot for contracting this virus. Walking outdoors or, if you have a gym at your home, any exercise equipment, using those during this period is the wise decision. And, smoking cessation. People who are smoking right now would be a good time to quit. And then getting into the vaccine itself. So there are 2 different vaccines that are FDA approved currently. One of them is the Pfizer BioNTech one, and the other one is the Moderna one. They both work very similarly. They are both RNA vaccines. And so the components, the ingredients are very similar. The key ingredient, of course, is the RNA. They also have several other ingredients that are mostly like fat. So the ingredients are not very different. The efficacy it's pretty similar. They're both in the 95% range after you receive your booster vaccine. So they both require 2 shots. The Pfizer one is the first one you receive, and the second booster you receive it in between 17 to 21 day period. The Moderna one is a little bit longer. Moderna one, you receive your first shot, and then your second booster shot is usually 28 days later, between 24 to 28 days later. But the important thing is that you need to receive the second dose. Without the second dose, this is not going to be effective long term. What do we know about the vaccine? We know that I'm going to talk about the Pfizer phase 3 trial, and both the vaccines had very similar trials with results. So the Pfizer vaccine had, during their phase 3 trial, they had more than 44,000 subjects that they studied. And out of those 44,000 subjects, they had really great results. They only had like less than 10. It was more like 6 people who had reaction, and those reactions were mild, and they were treated with just antihistamine and steroids. So the overall quality of the vaccine is very good. I know there's a lot of anxiety over this vaccine in the community because of the short period of time it took for the vaccine to come out. I can assure you that the quality was not compromised when it comes to creating this vaccine. The reason sometimes under normal circumstances it takes so long, it takes years to come up with a vaccine, is first of all, the resources. You have to, under normal circumstances, you don't dive into something with as many resources when the world comes together, all scientists come together. That doesn't happen. That's one. Two, typically it doesn't take very long to develop the vaccine itself. The technology, it doesn't take that long. What takes long is that trial phases and the different steps, the loopholes you have to go through to get approval to get to the next step. So in other words, is the bureaucratic steps that keeps some of these developments from from happening quicker under normal circumstances. So in a pandemic, a lot of those steps were removed. Those barriers were removed. And so it just went straight through. Has nothing to do with the quality of the vaccine. So the quality of the vaccine is very good. Otherwise, FDA would not have approved it. I myself took the vaccine. I actually just got my second booster shot last week. It went very well. There was another source of anxiety that I heard from a lot of people. They were just afraid of the reaction, how painful it was going to be. And I can tell you that it was honestly not any more painful than the flu vaccine. So it's a very, very safe vaccine to take. So I'm going to go over some of the CDC statements for this vaccine. So those who are approved to take the vaccine is 16 years old and above, 16 years and above of age. So the people who are excluded from the study, the trials before the vaccine was approved, one is pregnant women. So pregnant women were not tested during that trial. However, the CDC is saying that it is okay for the pregnant women to receive it. I personally know many pregnant women who have received it and they've been okay. But again, keep in mind that they were not studied during the trial phase. So that goes to saying that, aside from pregnant women, we really are pretty sure that the rest of the population, it is okay to take. As far as availability goes, they are doing it in phases. So the first week when the vaccine came out, the phase 1A population got it, which was primarily the hospital, the very frontline healthcare workers in the hospital. Now, it's still not quite available, the vaccine, to the general public, unfortunately. There in the Tarrant County, the county level is providing vaccine to general population. They are prioritizing 65 years and above at this time. But the place where you can go, you do have to register for it. If you want to write down this website, it is tcph.quickbase.com. That's where you'll go. I can repeat that. It's tcph.quickbase.com. It is the Tarrant County website where you go and register for the vaccine. And it's a pretty long wait time is what I'm hearing right now, but I urge you to sign up as soon as you can. I know that several other agencies are coming soon. They will start vaccinating. CVS is one of them. There are several grocery stores that have already started, not in a regular basis, like different Krogers and HEBs. And I know that they're planning a mass vaccination in Dallas at some point next month, hopefully. So, it's just at this point availability. Whenever the vaccine becomes available, please take the vaccine. This is what we need. And until you get vaccinated, maintain all precautions. That's pretty much the gist of what happens with COVID and COVID-related heart disease. And I want to end my talk by reminding you that 80% of heart disease is preventable. That's a big number. So 80% of heart disease is preventable under normal circumstances. I'm not talking about COVID related in general. And that prevention is through heart healthy diet and exercise and minimizing your risk factors. So it's really pretty simple. So thank you again for having me. This brings me to the end of my topic. I'd love to take some questions.
Oh, that is a very excellent, program for us from you. Alhamdulillah. I mean, it was a lot of information. I was trying to jot it down. Uh, I will open up for the audience to ask question. But before that, I have one question. Do you know who was the provider of your vaccine? Was it Pfizer or Moderna?
I got the Pfizer vaccine because Moderna was not out yet. I was one of the first ones to receive it here in DFW. And that week, Moderna was not out. So I got Pfizer. But my understanding is now the Pfizer vaccines are being, they're not giving any new ones. It's just the second doses are reserved for Pfizer. They're primarily providing Moderna now.
Oh, great. All right. Thank you very much. So, audience, please unmute yourself if you have any question, and please ask Dr. Farah.
Assalamu alaikum. I have a question. This is Maliha.
Alaikum
Dr. Farah, what do you think about taking vitamins like C and zinc and all that stuff to strengthen yourself so you don't get COVID?
So, excellent question. So, it's not that taking vitamin C and D and zinc will prevent you from getting COVID, because if you get exposed to COVID, the chances are you're going to get it. It's a very, very contagious virus. But it's still okay to take vitamin C, zinc, and vitamin D because it boosts your immune health. So even if you get the COVID, it prepares you a little bit better to fight it. There's no real data that's been studied to suggest that it actually helps, but these are just some small scale studies that people have tried, and some people are saying that zinc and vitamin D can help. It's not going to hurt you, so there's nothing wrong with taking vitamins and trying to boost your immune health.
So another question, do you still take them if your blood work shows that you don't have any deficiency of those you have in normal range?
That's right. That's how people are taking it. Yes, it's not for those who have deficiency. For COVID purposes, a lot of people are taking it even if they have sufficient amounts of both zinc and vitamin D. I can't really recommend taking zinc or vitamin D just because there's been no proven studies to suggest it really helps. It's more anecdotal than anything else. It's just some people have tried it, and a lot of people are suggesting it. So I guess there hasn't been a robust randomized controlled study done on either one to say that this could be a medical advice.
I have one more quick question. What does the supine position do?
Okay, very good question. So supine position means when you're laying down on your back. That's the normal way you sleep. Prone position is when you're sleeping on your front, like on your face down on your pillow. Prone is what's important when it comes to COVID. So those people who have COVID, this is actually something that would be advisable. For people who have COVID, we are advising them to sleep in a prone position because what it does, pruning, is it opens up the air sacs in your lungs, basically, the little airbags in your lungs and the airways. It just opens them up a little bit. So it helps breathing better. It helps movement within the lung, the pulmonary system. So it helps with congestion and all those things. So we're pruning actually people in the hospital, like the really sick people who have lots of congestion, they have the infiltrates, the pneumonia. We are pruning them. We're even pruning those who are on the ventilator, the really sick people, before they go to end up on ECMO. We prune them even while on the ventilator. We turn the whole bed around and prune them. It has proven to be beneficial for both the really ill patients, and also, even if you're not in the hospital, just at your home and you're COVID positive, I would suggest staying in a prone position when you're sleeping. It'll help.
Thank you.
Please unmute yourself if you have any question. Okay, well, our audience are thinking about questions. I have another question. So if somebody got positive with COVID and they recovered from the virus, do you have any further recommendation for them to go ahead and take the vaccine right now?
Yeah, that's another good question. So right now, our infectious disease specialists are recommending a wait period of 90 days. So 90 days, if you're positive for COVID, there's no CDC guidelines yet on this. We're still waiting for that. I'm hoping that wait time will be less, because I have seen both colleagues and patients who got COVID a second time within 90 days. So that's another point I want to make, is just because you're getting COVID one time and you're recovering, don't let your guard down, because you can get reinfected with it. So yeah, to answer that question, as of right now, we are following the 90-day thing, but it's not a formal guideline by any means.
Thank you. Okay. Any question from audience?
I have one more question. So when people are traveling, when they have to, how do you suggest to go in the plane? Obviously, wearing masks. Do you suggest to wear face shield too, or gloves and stuff like that?
So yeah, first of all, I would advise against travel unless you must, to everybody. But for those who have to travel, I traveled actually during COVID-19, and I gave an interview on this as well. So absolutely wear a mask. I would actually double mask. If you're traveling, especially by airplane, you must wear an N95 mask, I would say. N95, and on top of the N95, wear a surgical mask. And yes, a face shield would be helpful. If you can wear gloves, that's great. But what I did, I didn't wear gloves. I just took a lot of hand sanitization and wipes. So every surface that you sit on, you just disinfect and wash your hands often with your hand sanitizer. Those measures, it helped me. I didn't get COVID by doing that.
And it's hard to find N95 masks. So all we can get is KN95. Is that closer to N95?
It's supposed to be closer to N95, but it's still, as far as I know, it's not the same as N95. So yeah, unfortunately, KN95, if that's the closest thing you can find, then I would wear KN95 and surgical mask on top of that, and a face shield.
Thank you.
Any other questions from anybody in the audience?
Yeah, this is Irene, Dr. Farah. I have a question. Does COVID vaccine is good for someone who has a lot of underlying health conditions?
Yes.
Okay.
Yes, it is. People who have risk factors like high blood pressure, diabetes, cholesterol, smoker, heart disease, everybody, all those people are eligible.
And I think you mentioned there is no research done for the children. You said under 16.
Right.
So
Under 16 years old and pregnant women, those were excluded from the study. So we don't know. And that's why I don't believe they're administering the vaccine to anybody younger than 16.
okay. Okay, thank you.
You're welcome.
Okay, this is Shelly. I have one question. When after getting the vaccine, when it starts actually working, when it's effective, how many weeks or days we need to wait?
We don't know the exact time frame for that, but after your first shot, it takes about that first week, 1 to 2 weeks for it to give you a good amount of immunity. But the first dose really doesn't give you that 95% efficacy we're talking about. That's not with the first dose. They didn't really give us a specific number of what the percentage is after the first dose. We think it's close to 40%, but that's not a number we got from CDC. But it takes a few weeks for that immunity to kick in after the first dose. And then, your second dose for the Pfizer, it would be after 3 weeks, 21 days. After you receive the second dose is when you get that 95% efficacy. And I believe that too takes a little bit of time, like 1 to 2 weeks, most likely. But we haven't received a specific guideline on that time frame from CDC.
Thank you.
You're welcome.
Any other questions from the audience?
Yes. One more question. Could you mention a little bit about the mild symptom? Like what kind of mild symptom you think someone could have that could be we can suspect they may have COVID symptom?
Yeah. Mild symptoms would be like, just flu-like symptoms, like just body aches, fatigue. Fatigue is a really common mild symptom that we're hearing from pretty much everybody. They're having lots of fatigue and mild degree fever, like, 99, 100 degrees, and some amount of cough, a little bit of cough. Anytime it gets to the cough stage, you have to be really cautious. And then there are asymptomatic spreaders too. And that's what's causing all the trouble, honestly, is because majority of the people who are spreading it are asymptomatic. They show no symptoms whatsoever, but they are infectious. They're spreading it to people. So those things would be things to watch out for. And one thing also is loss of smell and taste. That's actually fairly common. Loss of smell and taste. Some people are losing some amount of taste and smell, which is mild, and some people are losing it entirely. That's a little more than mild.
Thank you. So at what point we should be contacting the physician to see, if you should be any medicine or are there any medicine that the doctor are, giving the patient?
Yes, there is actually. So if you're having mild symptoms and you test positive, ask your doctor regarding something that's called monoclonal antibody. Monoclonal antibody. So monoclonal antibody is similar to convalescent plasma. This actually just got FDA approved just about 3 weeks ago. This is the same medicine that was given to President Trump when he had COVID. At that time, it was trial medicine. It was not approved, but it got approved 3 weeks ago. It's very similar to convalescent plasma, but it's called monoclonal antibody because it's specific to COVID. It has only one antibody in it, and that's the COVID antibody. What it does is it helps neutralize the virus in our bodies. So it essentially reduces the viral load. This medicine is only approved for outpatient, meaning exactly what you mentioned, mild to moderate degree symptoms, people who are not hospitalized. If people are requiring hospitalization, they're not eligible for this medicine. So it's only for non-hospitalized patients with mild to moderate COVID symptoms. So if you're having mild to moderate, like moderate would be like, you're having cough, you're congested. Cough is in my opinion, cough is a moderate symptom. because at that point it's in your respiratory, in your lungs. And so the monoclonal antibody is very important. It's actually helping reduce the viral load, and it's preventing people from getting severe, their condition from getting severe. And a lot of people are not needing hospitalization if they're getting the monoclonal antibody on time. It does matter when you get it. It has to be in the earlier phase of the virus, because so within the first day or two of being positive, you need to receive this, because after that, it's not as effective anymore.
I have a question, Dr. Farah. Are you guys seeing in the hospital system what percentage of the people are coming with flu and the COVID? How do you distinguish those two?
They're very difficult to distinguish because the symptoms are very similar. Honestly, we're seeing more COVID now than we are seeing flu. Anybody who's coming with COVID, anybody who's coming with symptoms, any kind of symptoms of cold-like symptoms, they're all being tested for COVID. Most hospitals are pretty much testing everybody who's coming through the ER for COVID, and especially those who are displaying symptoms. More people with COVID than flu at this time.
Is it because of all the hand sanitizing and masking and all that stuff helping to get flu?
For the flu? I'm sorry, I didn't understand your question.
The hand sanitizing and the social distance, wearing masks, that's helping also for the flu.
That's helping with the flu as well. That's right. Yes. Typically, during this time of the year, hospitals are full with flu patients, but this year it's quite different. It's mostly COVID patients in our ICUs right now. And, we have so many COVID patients in Tarrant County alone. It's overwhelmed our healthcare system pretty badly. So.
So do you think, or the CDC has any recommendation that this COVID vaccine is going to be like a flu vaccine, or that we have to take it every year?
That we don't know yet. We don't know. That's one of the questions that was not answered by the trial, is the duration of immunity, how long the immunity actually lasts. We don't know that. So that is probably the part that would need ongoing testing.
So is there a chance after the second dose you can get COVID, or?
That is a very good question, and that's also not been answered. Well, it has actually. So let me break that question up. Yes, even after you get your vaccine, you can get COVID. You're not immune from getting COVID. What you're immune from is not being serious, like, not getting seriously ill from the COVID that you get. And even after you're vaccinated, you're not going to know it if you get the COVID, because you're going to be, you're going to have your immunity working for that, but you're going to be a spreader. So you can still give it to others without knowing. So that's why it's going to be real important for us to realize that and continue to wear masks, because if you get the vaccine, you're going to be immune and protected, but you can still get COVID and give it to somebody else who's not been vaccinated yet. So we need to keep that in mind. That was an excellent question. Thank you for asking.
How long do you have to do that after getting the second one?
After getting the second one, like, you should do it indefinitely, because as I said, that even though you're going to be protected, other people who haven't received the vaccine will not be protected. So you can be a spreader to somebody else. And so right now the CDC guideline is you need to continue to maintain all the precautions, like continue to wear a mask, continue to maintain social distance, large gatherings avoiding, and travel avoiding. So everything we've been doing throughout the pandemic, the vaccine doesn't change that, not in the short term.
Oh boy.
Yeah. I know it's we're going to be in it for a little bit longer, like, until everybody gets vaccinated, which it'll take most of this year to vaccinate everybody.
So I live in North Carolina, and we have a very small masjid here, and most of the members are African American, and probably that in that population, they're afraid of vaccine. What happened so many years ago, that the syphilis vaccine was they think it was for them to not having kids or whatever. So they are very not sure to get it or not. What do you say to them, those population?
The message is pretty clear for them. They need to get the vaccine. You know, in many communities, different communities for different reasons, like, religious beliefs, or, there are so many different types of beliefs, they're opposed to the vaccine. And in fact, in America, there's a large group of people who are anti-vaccine.
Right.
There's a whole anti-vaccine group.
Mhm.
And the message to all of them is this is the one time they need to let go of those and believe in science, because until then, we're not going to get out of this pandemic. We need to have mass vaccination. Majority of the population that needs to get vaccinated, and only then we can hope to begin to have some normalcy in our life back. So really, they have nothing to fear. The fear should be COVID, not the vaccine.
Yeah, they should have some ads on TV and stuff to promote it.
They should, to educate people. We're doing as much as we can, vaccination campaigns and things like that, because, in Texas, a lot of people are opposed to vaccine. They were, but as we're speaking to more people, we're turning them around, and they are more amenable to getting the vaccine after they hear from doctors. I have lots of people in my clinic who come in saying, oh, I'm definitely not getting the vaccine. And then I'll talk to them and be like, oh, wow, I'll go sign up. So it makes a difference. Education makes a difference.
Yeah, especially the Trumplicans.
Yeah.
Thank you.
Are you welcome?
Okay, so I have another question. So if somebody take vaccination, are they contagious? Like if someone in your family, let's say, took the COVID vaccine, so that person would be contagious to other person?
So COVID vaccine does not make anybody contagious, the vaccine itself, because this is not a live virus vaccine. This is only the RNA. So there's no live virus in COVID. So you cannot get COVID by getting the vaccine. So therefore, no, you're not contagious to anybody else from getting the vaccine itself. But as I said before, even after getting the vaccine, you can still contract COVID-19 and then be contagious to somebody else, just as you did before getting the vaccine. That part doesn't change.
Okay, yeah, I got that. Thank you. One more question, not COVID, but I had a question earlier I wrote down. What is the difference between, I think you mentioned a little bit between like gastric pain and heart attack chest pain? Like, how can we distinguish between those two pain?
You're talking about the atypical chest pain?
Yeah, like
Yeah.
somebody to have a heart attack, the pain, chest pain, and somebody who have a gastric pain. How can you distinguish them?
Yeah. So typically, if it's heart attack and you're not having chest pain and it's like indigestion, like symptoms like gastric pain, as you mentioned, it's going to be pretty different from your usual heartburn. It's a very severe type of heartburn and it just won't go away. And one key way of distinguishing it is usually when you have, gas-related pain like reflux, you take medicine, right? Like over the counter or something that you have like Tums, some kind of gas X medicine. And typically it goes away if it is due to GERD, like, reflux symptoms. But when you're having a heart attack, it's not going to go away. And that's a key distinguishing factor. And typically also people are vomiting, usually with indigestion-like symptoms. They're nauseous with heart attack. And a lot of times they also feel clammy, like they're sweating. It's not usual. They know that it's different and it lasts for a long time.
Okay, thank you.
I have a question, Dr. Farah. I heard that the nexium it's not good when you have COVID, or it cancels the whatever that is. I don't know. That nexium is not a good choice of taking if you are taking that medication.
I have not heard anything like that. As far as I know, it should not have any reason to interfere with COVID back. Like, I'm not understanding. Are they saying it?
They're saying that if people who takes nexium, it destroys the vitamin C or the acid in your stomach.
Oh, I see. No, I don't think so. No, yeah, it is. Nexium is a acid inhibitor in the stomach. That's how it helps people who have, like, acid reflux symptoms. But as far as I know, I have not heard of any medical journals, at least, have not proven that Nexium has any adversary effects to COVID.
Okay,
Yeah.
thanks.
So I would not stop Nexium because of COVID.
Yeah, I heard that not take Nexium, but take the Prevacid, the Flume. I don't know.
You can take Prevacid. There's Protonics. There are several, but honestly, I don't know the credibility of that Nexium thing you've heard, because I haven't heard anything like that.
Okay, thanks.
Yeah.
Okay, thank you very much. We are almost at the last minute of our program. So if you can clarify, Dr. Farah, what is the difference between RNA and what is the other different types of vaccine? You said live virus you need. What is the name of that vaccine?
Okay, so the live virus vaccine, those are other types of vaccines, like, for instance, polio. It used to be live virus vaccine. But the COVID vaccine, all manufacturers, none of them are live. They're all RNA.
Okay, great. Thank you, everyone. Anyone has any last question which can be answered with very short time?
Is flu vaccine live?
Flu vaccine is not live. The one that they inject is not live. There's another form that they spray in your nose, that is live. So if you get the spray kind in the nose, that's live, and you can get flu from that. But the one that they inject in your arm, that's not live, and you cannot get flu from that.
Okay, thank you.
You're welcome.
All right, it was very beneficial program for our community, and we really appreciate your time and pray to God Almighty, may Allah subhanahu wa ta'ala protect you, your family, and protect all of us, and help us all to understand and take the precautions that are necessary to protect us, our family, and our community member. So thank you very much, Dr. Farah, and we really appreciate it, and may God bless you. Thank you.
Thank you very much. Please keep me in your prayers. It was a pleasure to be here. I definitely appreciate you guys inviting me. So thank you.
So much, we appreciate it.
You're welcome. Take care.
Okay. Assalamu alaikum.
Assalamu alaikum.